Meconium aspiration syndrome, MAS. Okay? Clue. First clue, look for a post-term baby. Okay? Or another huge clue. Okay? I love it. I love that. Okay. Another clue for meconium aspiration syndrome is when they rupture membranes. Okay, when they rupture membranes, they'll describe meconium. Now, meconium is baby poop or fetal poop. Meconium is fetal poop. And for the most part, babies, fetuses, don't pass meconium in utero. If you have meconium-stained amniotic fluid, you should be suspicious for some kind of event in utero. Okay? Some kind of event in utero. The baby is stressed, relaxes the sphincter, passes meconium, it's in the amniotic fluid. When the baby is delivered and it takes a breath, that meconium-stained amniotic fluid that's sitting in the upper airway gets aspirated. Now, light meconium is not a big deal. Thick meconium is a big deal. Okay? Thick meconium is a big deal because it just gets into the lungs. It causes an aspiration pneumonitis. And meconium is really sticky stuff. All right? And it causes an aspiration pneumonitis. The baby will have respiratory distress, and once again, the best initial test, chest x-ray, okay? It won't look like ground glass appearance, okay? Ruptured membranes, what we're talking about, Thanmayi, on ruptured membranes, is when they ruptured maternal membranes, okay? When they rupture the membranes and the amniotic fluid comes out via the birth canal, you'll see thick meconium, okay? All right, so the baby's delivered, has respiratory distress. The best initial test is a chest x-ray yet again, but you don't see a ground glass appearance, okay? It's more of it's like an aspiration pneumonia. It can go anywhere. Here you see look at this side. That doesn't look too bad. But over here, it looks different compared to this side. The heart border isn't as clear. So there's an aspiration pneumonia here. Okay, so clue. The first clue could be gestational age being post-term. So that there's a higher association of post-term babies with meconium aspiration. But a bigger clue would be meconium when they rupture membranes. Not so much because of oligohydramnios, but because sometimes these post-term babies are stressed and they pass stool. Okay? And again, the best initial test is the chest x-ray. So what do we do about it? Because what does meconium aspiration syndrome do? Well, meconium aspiration syndrome causes a lot of hypoxemia. And hypoxemia in the lungs causes pulmonary vasoconstriction. Pulmonary vasoconstriction increases the pulmonary vascular resistance. And therefore it's harder for blood to get to the lungs, and blood will then shunt, okay, deoxygenated blood shunts across either a patent foramen ovale or a patent ductus arteriosus. That, in turn, causes more hypoxemia, which then causes more vasoconstriction, which causes more pulmonary vascular resistance, which causes more shunting, and we call that pulmonary hypertension of the newborn. And we used to call it persistent fetal circulation. And meconium aspiration can lead to that. So what's the treatment? Well, first of all, we want to prevent. We should always flip-flop these. Prevention is more important. when the baby's head is delivered, even before the baby starts to cry, when the head is delivered, good suctioning of the oropharynx with the bulb suction will help. If, okay, now this is a more of a step 3 freebie, but it might be in step 2, okay? If there is thick meconium, you do endotracheal intubation, okay? Endotracheal intubation and suctioning of the airway, but only with thick meconium. Okay, so deliver the baby, suction the oropharynx, but if there is thick meconium, okay, if there is thick meconium, deliver the baby, endotracheally intubate, and suction the airway. Only for thick meconium. Thin meconium, you don't do anything, because intubating the baby can cause more problems. Okay? You guys have the distinction here? If it's thin meconium, deliver the baby and suction them. If it's thick meconium, deliver the baby, intubate the baby, and suction. Only for thick. Okay? Does that sound okay for you guys? Thick, intubate, suction. Right. Thin meconium does not cause meconium aspiration syndrome. That is correct, Sadaf. Thick meconium does not really cause meconium aspiration syndrome. And then you could theoretically cause more problems by intubating the baby. It's just not worth it. We've learned that now. Okay? Only intubate for thick meconium.